Hi and welcome back. Today we're going to talk about asthma. This could be a 35-part series and never even scratch the surface of everything we need to talk about, but we're going to try to muddle through. Asthma is a two-pronged problem: airway inflammation and bronchoconstriction. The airways are made out of smooth muscle, so the only thing they can really do when they get irritated is squeeze. That's the tightness that people feel when they breathe that also results in wheezing. The underlying inflammation ultimately can lead to remodeling or scarring of the airway tissue. And so we now know that it's really important to take a proactive stance against asthma rather than just waiting until people are having asthma attacks to put them on medication.
Mikey, I want you kept inside. Rand, if he's coming down with asthma, I don't want him out in the rain.
It might seem like I'm really teeing off here, but I have to tell you, while I try not to be too divisive, I am strongly pro-breathing. There, I said it, and I'm not going to apologize for it. So, I digress. Continuing on. Next is the mild persistent asthmatic. That is someone who has symptoms regularly and needs something to help keep that inflammation under control so that we don't wind up with the wheezing and sometimes coughing that goes along with it. For these people, we could put them on the pill montelukast, which we discussed in our allergy video. It's a leukotriene receptor inhibitor. Sometimes antihistamines really help. It depends on the person as to which inflammatory mediator is really at the root of their symptoms. But sometimes that is good enough by itself to help keep them from having attacks. If it's not, sometimes we use a single agent inhaler like a steroid. The thing about steroids, if you use long-term systemic steroids like prednisone, etc., those can lead to complications like adrenal suppression, osteoporosis, etc. When we're talking about the inhaled medicines, they just go to your lungs and help with the inflammation. Less than 1% is absorbed into your whole system. So we typically don't have to worry as much about that as a side effect or a long-term complication. What we do have to watch out for is thrush or a yeast infection in the mouth, because steroids are like Miracle-Gro for yeast. So when people use that, if they're having issues with your typical puffer inhaler, we'll often give them a spacer device or an aero chamber. This one is compact space chamber. What you do is you put the inhaler in this end and then you squirt the medicine, and then that way you have the medicine kept in here and inhale it, and you don't have to time as well with the actual puffer. And that can help get the medicine into your lungs better and really decrease the side effects of steroids. We also recommend that people rinse their mouth and brush their teeth and their tongue after using anything that contains a steroid in inhaler form. So, if the steroid alone doesn't work, we can use a combination inhaler that has a steroid and long-acting bronchodilator or beta agonist, also called a LABA, long-acting beta agonist. And there are different ones. Some people tolerate all of them great. Some people, because of the long-acting beta agonist being different in certain medications, might experience feeling of anxiety or jitteriness. Sometimes they'll even have heart palpitations. That happens to me with certain long-acting beta agonists and not with others. So you might talk with your doctor about choosing the one that's right for you. The common medicines here are Advair, Symbicort, Brio, etc. And you just have to find out which one is going to work best for you and which one is covered by your insurance, because they can get pretty pricey. For those who that is still not enough, there's another agent, an anticholinergic, that can be added in, and there are some inhalers that have all three types of medications in them, and they can be really useful for people who have extra secretions being produced. Again, we have to use our precautions with the steroids and picking the right one due to the side effects of jitteriness and those heart palpitations, but people generally do very well with them, and maybe in combination with the Singulair, also known as montelukast. It's also important for anybody who has asthma to have an action plan, meaning what happens when we start having symptoms. We like for people to take their peak flow, which is where they can measure how well they're breathing, Not everybody has a peak flow meter at home, and for some people it's just not convenient, or they just don't want to do that. So it's nice to have an action plan written out for if your symptoms start getting worse. That might mean you increase the frequency or the strength of the medicine that you're using. It may mean that you add in a rescue inhaler as needed until things calm down. Your doctor may give you a prescription for oral steroids to take for a short course to get the inflammation to go down. But it's very important to have your asthma action plan in place so that you and your doctor both know what you're going to do if you start having a flare. It's also important to stay on top of your seasonal vaccinations, flu, pneumonia, COVID, and maybe plus or minus RSV, depending on what age you are. Some people have a nebulizer around if they have severe asthma attacks. Those can certainly help keep you out of the emergency room if that's all you need, a little bit more. It's like a rescue inhaler, but a longer treatment. Those can also be a very helpful adjunct. If all of these things aren't enough, you may need to see an allergist or a pulmonologist to talk about other medications like biologic agents that may be useful in helping control your symptoms and significantly improving your quality of life. All of the prevention strategies, all of the different medications, hopefully you can be active and get back into your life. Don't forget to like and subscribe, and stay tuned for more.